Okay, so today I'm going to be talking about the labor and delivery department of the hospital, who works there, what they do, and how they affect the hospital. So first I'm going to talk about the labor and delivery nurses. They start off their day with receiving a report from the last nurse about the patient that they're taking care of. It's going to be a list of medical history, birth plan, complications that they may have. And so first you're going to introduce yourself, check their vitals, check for any contractions. If they need any pain IVs or anything, you can administer them some pain relief. You, as a nurse, you also are going to perform cervical checks to see when the cervix is dilated enough to have the baby. You can assist them with pushing if it is time for labor. And also, fetal heart rate monitors and contraction monitors are very helpful to track the labor progression and to be sure that no decels are taking place in the baby. And then the nurses also, after labor, help clear the baby's airways and stimulate breathing. They additionally do the APGAR score. They assess it, and it tells them at 1 minute and 5 minutes respiratory effect, heart rate, muscle tone, reflexes, color. It's really helpful. And they monitor the baby's vital signs, including their heart rate, respiratory rate, and oxygen levels. And they document them down to kind of also figure out what progress they're getting. And after that, they support the first breastfeeding attempt for the baby. Labor and delivery nurses work alongside with OBGYNs, anesthesiologists, any other healthcare professionals in that segment of the hospital. They are big advocates for the mothers and ensuring that they get the birth plan that they want as best as they can if it's not a danger to them. And they also administer any necessary injections or vaccinations to the baby. To become a labor and delivery nurse, you have to have a nursing degree, you have to pass the NCLEX-RN exam, and gain specialized training in labor and delivery. Labor and delivery nurses have a very fast-paced job with high-pressure environments, and you just have to have quick decision-making skills and adaptability because you're probably going to have a different patient every day with new experiences and new complications. The next one we're going to talk about is the OBGYN. They specialize in women's reproductive health, and they're the actual doctors who deliver the babies. And they kind of help with checkups, monitoring the baby development, checking up with their nurses, getting all the information they can. But a lot of the things that they do is really just delivering the babies and training the younger doctors into becoming residents. And the problems that they really have to deal with is the excessive bleeding pregnancies, the umbilical cord development issues or whatever. A lot of all the C-sections can't be done by the nurses, and so because they're not really certified enough and they don't have enough knowledge. And they provide also some postpartum care and life-saving interventions like CPR or intubation. Their job is very demanding and emotionally challenging, but it's very rewarding when they get to see the mothers see their baby for the first time and get to hold their baby, and all the family gets to be excited. So that's awesome. And to become an OBGYN, you have to have a 4-year bachelor degree, 4 years of medical school, and 4 years of residency. Board certification is optional, but it is recommended. And ongoing education is required so that they can keep up with the new information and knowledge. An anesthesiologist in labor and delivery is responsible for administering the anesthesia, of course, such as epidurals or general anesthesias for C-sections. Based on the patient's health and delivery type, kind of just depends on what kind of anesthesia you give them. They monitor the mother's vital signs, adjust the anesthesia as needed, and manage any side effects to ensure safety. Particularly high-risk or emergency situations, they're really needed. So they kind of go on shifts as well so that they can have someone there 24/7 ready to take over. And to become an anesthesiologist, you have to complete a Doctor of Medicine degree, MD, and Doctor of Osteopathic Medicine, which is a DO degree, followed by a 4-year residency and specialized training in obstetric anesthesia. They must be board certified by the American Board of Anesthesiology, and their role is just really vital for pain management and patient safety during childbirth. A sonographer is specializing in obstetrics and performs ultrasound scans to confirm pregnancies, determine conception dates, like multiple pregnancies at a time, and then ectopic pregnancies, which is where the baby like grows outside of the uterus, which is a big problem, and they can just monitor fetal health in general. They assess amniotic fluids, detect abnormalities, anything like that, birth defects in the pregnancy, and they play a crucial role throughout pregnancy, and they can provide like information at the best times. Like if they just need to get a quick scan in and figure out what's going on, they can do that, which is really helpful. But if they make errors, it can cause a big effect on the baby or the mom. So it's a really precise job, and errors can impact the clinical decisions. So you have to be really careful with that. But when you're in the hospital, entering the hospital, there's 3 different types of rooms. The first type of room is a labor room where the women are monitored throughout labor, and they're always checked up on. The next room is the operating room, which is where C-sections take place, emergency deliveries that require surgery, anything like that occurs. And then last is the recovery room, which is post-delivery care and monitoring the baby and monitoring the mother to assure like stability before they're transferred on to postpartum. Last thing I'll say is, if you're considering a career in one of these fields, just be prepared to embrace an immense responsibility and dedication, because you'll need a strong work ethic, and you'll have to be able to handle a lot of pressure, because this job, like I said, is very demanding. And you're, especially as an OBGYN, you're going to be a leader and working not independently exactly, but you want to be a leader for others. So yeah, but all of the work that you put in is going to be really rewarding when you see the reactions from the families and the moms. So yeah, thank you for listening.